everybody, and welcome to Economics Monday on the IBM TV Network, International Broadcast Media. And I'm here with Dr. Dan Worthington, the Associate Dean of the University of South Dakota School of Law. I'm also with the famous Peter Bennett. Peter is actually on modern investing with Sasha, and the guy who heads up modern investing with Sasha has also arrived. And of course, that is Sasha Starr. Sasha, welcome to the show. Dasadanya. And today we're going to be discussing some of the parts of this book, which I think is a great book for those who haven't received it. America in 2040, Still a Superpower, which becomes a really good question given the economic conditions of the United States of America, which is not discussed, which he discussed in chapter 17 of his book, Healthcare Cost. The Medicare, Medicaid, and healthcare cost in general in the United States keeps rising. And he even discussed, David Walker discussed these unfunded liabilities, Peter. So what's going on? I'm going on Medicare next year. Yay, go Medicare, free health insurance. But what about these unfunded liabilities in Medicare and Medicaid, Peter? What do we have here?
Well, the more I start digging into it, the more I find and the scarier it is. First of all, it's a worldwide problem, but starting with the United States as an example, the U.S. says that we have $27 trillion in debt, and that scares everybody, and of course people know it's going to increase. But the unfunded liabilities for just Medicare and Social Securities could be 200 trillion, maybe 150 trillion, maybe 250 trillion. That's because basically the government hasn't put away any money for that. They haven't put away much for Social Security or anything for Medicare. And they've been taking money for decades from Americans, saying, okay, we're going to take a piece of your salary. So the amount for those two alone, I've read, is more, if you look at it as 200 trillion or 250 or somewhere in there, than all stocks, bonds, and real estate that's privately owned combined in the United States.
Well, we're also going to get a CPA to verify this, and with that, we're going to stretch across to California, and we're going to bring in Blake Christian, who is a CPA and a tax partner with Holt-House, Carlin and Van Treck, the fourth largest CPA firm, I believe, in the state of California. Now, Peter says we're broke, beyond broke, 200 trillion in the hole because of unfunded healthcare liabilities from Medicare and Medicaid. Blake, is it that bad over here?
Oh, I think I agree with Peter. It's probably worse than that. It's probably underreported. But here's a couple of examples. And actually, for 3 years, I was the tax director of a national health maintenance organization. And so I kind of saw from the inside, got pretty disillusioned about the healthcare system. And my wife recently went in kind of an emergency kidney stone situation when she was back in California. We just got the bills for that. She was in the hospital for less than 3 hours. No surgery, anything. It was just here's a pill. We'll do some X-rays. Take a wild guess how much that cost. I'll save you the time.
$20,000.
$20,000.
How's that for a guess?
That was pretty good.
$20,000. That's where the problem is. And I saw when I worked for the HMO, you would have things that would move from surgery, where you'd have to spend a couple of nights in the hospital, to outpatient. And miraculously, over the course of the next 6 or 9 months, when it became an outpatient surgery, the total costs were about the same as when they were stuck in the hospital. It's, the healthcare system's broken in the U.S. We need to do something. I don't have the solution, but it's a very, very frustrating situation.
Well, we're going to reach across the pond and bring in our billion-dollar money manager. Let's bring in Shaquille Latimer from Australia and see what he has to say about solving the healthcare problem that we have in the United States, which apparently Medicare, Medicaid, David Walker says it's about a $42 billion unfunded liabilities. Peter and Blake say
trillion.
Oh, trillion?
42 billion, that's not going to bother anybody.
No, it's not 42. He must have said
42 trillion. Excuse
Yeah,
me.
I'm saying-
Excuse me. 42
Right, and I'm
trillion.
saying
And you're
200
saying how
trillion.
much? 200 trillion. And since you manage billions of dollars, notice how tiny those billions become when we're talking in terms of trillions here, Shaquille. Okay.
Well, I may.
What do you guys do down under to solve this unfunded liability on healthcare?
Oh no, we actually run our economy properly, so we don't have that problem. But I may have to be introduced in the future as the unemployed guy from Australia, because I've recently had an offer made to us to buy out the management company of my hedge fund operations in Liechtenstein. And I'm probably going to take that. So I'll just be like some unemployed. Maybe I could get Social Security money or something. I don't know. I could.
Well, yeah, if you come over here, you can get on the dole. I mean, that's
Well,
not
that's
a problem.
right. I could hide all my money and get myself on the IRS list that was released, and I could apply for Social Security benefits.
Oh yeah, you know what you can do, Shaquille? You can become a television show host now that you're unemployed. Okay, once you sell your fund managers, but
I could retire at the ripe old age of 37. But to answer your question about healthcare, look, around the world there are different systems, and they all have their good points and their bad points. And I think that a lot of people who in America will advocate for single-payer healthcare or universal healthcare don't want to pay any attention to some of the drawbacks that has. And the most obvious one is that when government provides the healthcare, government also has a say in what kind of healthcare you get. And, if you look at countries like Sweden and many other parts of Europe, if there is a medical treatment that's not automatically covered by the existing whatever system you have in Australia, we've got Medicare, if it's not covered by that, oftentimes you're not allowed to have that service even if you're prepared to pay for it yourself. Australia has a mixed system, so we have a universal healthcare system through Medicare, and you also have private health insurance that you can have on top of that, which allows you to be treated as a private patient. So that's a bit more of a mixed system. But again, different countries have different systems, and I think that you want to try and find a balance, especially in a country like America, like the United States. You want to be able to find a balance between having government provide the funding without taking away choices from people. And I don't think it would be that difficult, but I think the difficulty is there because of this kind of all or nothing approach between the two major political parties and the two factions. It's like we don't want to change anything, or we want universal healthcare for all. Pharmaceutical costs are really high in the United States. You guys are spending, last time I checked, somewhere in the range of 18% of your GDP is going to healthcare. That's an enormous amount of money. I think that there are more efficient ways of doing it, and I think that as a nation, it's really a blight on your country because it puts you so far different to other wealthy Western democracies. So you need to be able to provide healthcare to those people who need it, but you don't have to, in order to provide that healthcare, take away choices from people that perhaps can afford other things or just want to choose other things. Because some people don't trust certain medical treatments. They want to try a different type of treatment. I know a lot of cancer patients will say, look, I'm probably going to die anyway. Let me try this other experimental thing. And if it doesn't work, well, hey, I was going to die anyway. I personally believe that they should be given that choice. So I think that you just try and find that balance. Otherwise, what you end up with is the idea of, okay, let's just keep funding everything. And as has been alluded to, $42 trillion, you've got $200 trillion in unfunded liabilities. Biden's plan is 10 trillion, 12 trillion or something over the next 10 years. It was a concern before when you guys are running $1 trillion per year deficits. Now it's just like, it's like, are you guys trying to go broke? I mean, what are you doing? And with inflation at 5%, I mean, what's the M2 money supply in the United States? 350 trillion. So that 5%, that equates to $17.5 trillion devaluation in the M2 money supply of US dollars. And I can tell you, if I was a Middle Easterner whose currency is pegged to the US dollar, I'd be really annoyed that, to no benefit to my country, because of domestic policy in the United States, I've seen the value of my dirhams or my dinars or whatever they're using over there has decreased. That would aggravate me quite substantially. So I think that's a problem.
All right. Well, we'll go to Professor Worthington, but then we'll get to you, Peter. Professor Worthington, since you taught at the University of South Dakota, was part of your law school classes when you were the associate dean. America Going Broke in 2040, was that one of your offerings at the University of South Dakota School of Law?
No, but I was also a vice president of one of the largest healthcare systems in the country, so I have a little experience about the gaming that the healthcare systems do in this country, and how a lot of the hospitals and the medical systems are set up so that essentially what everyone was doing was paying for the unfunded cost of uninsured or underinsured people in their systems. And so there's these great, large, unfunded liabilities. And so the pricing was never honest. The cost was never the cost. In fact, the brokered costs or prices to the insurance companies are far less than the prices that the healthcare providers, doctors, and others provide, because they're negotiated. And so it's a game system. It's corrupt. Many of the senior executives at my hospital, even back then, were getting $1 million bonuses and $1 million salaries, and it was just absolutely ridiculous for a nonprofit hospital. And so we see a system that's basically bloated and corrupt. We talk about the pharmaceutical industry in the United States. What corruption? And I think Trump tried to do something about that. The problem is that the pharmaceutical industry pumps hundreds of millions of dollars into lobbyists and others to affect their votes in Congress and influence. And so they're peddling influence, trying to get free of all liabilities from problems that they have with their pharmaceutical drugs and other things, trying to get Congress to exempt them. For example, on the coronavirus vaccine, no, they're not responsible. It's ridiculous. Even though there are people dying from these vaccines and having heart attacks, strokes, other things, that no one's held liable. It's ridiculous. And so the problem with the United States is the system's bloated, it's corrupt. The insurance companies and others are and I think the early try by Hillary Clinton on the DRGs and the other things made the matter worse. Social Security Medicare is quickly becoming what Shaquille said, a system, it's just like the VA, a system of rationing healthcare, and it's only going to get worse.
Mm-hmm.
The problem is, and a solution is exactly what Shaquille says: two-payer system. The problem are two-level system, private and public insurance, and so you're taking care of the people that can't afford insurance and are can't deal with that, and you're spreading that across that risk across the nation with premiums and other policies that cover people in the basic healthcare system. And then the people who can afford it get the higher level of coverage for stuff that's not covered by the national policies. Doctors are going to probably have to take a pay cut. They do everywhere else in the world. Here, it's proctologists do 18 holes and then to go and do 18 more in the golf course. So it's sort of like... it's a bloated system. It's a corrupt system, and we've sort of done it to ourselves.
I don't think doctors necessarily would have to take a pay. I won't jump in though. Peter wants to say
okay, well, I got one more. Sasha Starr actually lives in Canada, but before that, he was in Russia. So when it comes to corruption, he's our subject matter expert, and he also, when it comes to a different system altogether, when it comes to healthcare in Canada, he's also our subject matter expert. What are your thoughts about America 2040? Are we still a superpower? We're going to go broke paying for Medicare and Medicaid?
I think America will remain a superpower. The only one area where America is behind many countries, including Russia and some other wonderful countries, it's corruption. By the 2040, I think America will close the gap and will will be one of the first in the world, if not already. Now, I was pleasantly surprised to find out that all unfunded liabilities of Canada, as we speak, are only $2.2 trillion. It's including pensions and Medicare and just anything, whatever we can come up with. For Canada economy, $2.2 trillion is definitely something. I'm not ready to dismiss it, but it's not hundreds of trillions of dollars like we spoke earlier. So at least don't forget that Canada's economy is about 1/10 of US, and the population is much smaller, probably 9.5 times smaller. So Canada is not doing fantastically well, but I think it's manageable. These numbers are definitely manageable, and hopefully it will remain so next little while. This is basically talking about the status of superpower. David Walker described in all details what superpower means, and hopefully America will remain superpower by 2040, although the problems remains, obviously.
Yeah. Yes, Shaquille, you had a comment.
Oh no, Peter was going to say something before. So.
Oh yeah, Peter.
Yeah, couple of clarifications. One, what Dan was saying about insurance companies. Insurance companies in America take 2.5% profit margin to administrate the whole system. It used to be actually 3% under Obamacare, but premiums are up so much under Obamacare, and it has helped some people and hurt others, but it's only 2.5%, which is a very fair margin, I would think, and very low compared to many other industries. So I don't think it's really, and it's not a very cut-up system. I know because I'm a part-time health insurance agent. I've been for 20 years, and I know how they operate. They're pretty efficient. Not perfect, but pretty efficient. But my main point, first of all, is it's a worldwide problem, and it doesn't affect. It'll affect whether the U.S. is a superpower, but it'll affect every country. So I don't know if it relatively hurts or helps. But if you look at, I've looked at the Social Security integrity of other countries as a proxy for how they might be doing on unfunded liabilities for Medicare. And I looked at India, I looked at China, which is really bad shape demographically. I looked at Australia, I looked at Europe, I looked at South America. All these countries' integrity on their Social Security systems, which is their pension systems, is very low. Canada, by the interesting, Sasha, is a little bit better. But for instance, this study I just pulled up, they're one of the best at 70% funding. So that's still a lot of liabilities. But these other countries are promising free health care to everybody. So as their populations age, I'll add another point, which I haven't mentioned much, but long-term care is incredibly expensive. And in the U.S., we provide Medicaid for poor people who don't have many assets and income. And we're talking about, I've seen statistics like 70% of people over 65 in the United States are going to need some long-term care. 20% are going to be hospitalized in an institution for more than 5 years. And that costs about for each of those people, it's $4,000 to $8,000 a month just for long-term care, even if they're in their home and get home health aides. So demographics is destiny, and the whole world is facing the same problem. The last point I'll bring is, Shaquille, you mentioned solutions, and you mentioned something very important, which is rationing. And that is one of the difficulties because, a lot of the expense goes to older people who get a lot of care, and it's very expensive. You have a 95-year-old or a 100-year-old who might need $1 million worth of treatment. And if the government's in charge, in most countries, I believe all countries, they'll give it. In the United States, we'll give it. But who's going to say that 95-year-old or the 90-year-old or the 80-year-old shouldn't get that treatment. It's very difficult morally to say no, you know, you don't get to live because it costs too much, but it's very expensive.
It is expensive. And somebody who has recently had this experience, we're going to bring in the founder of the IBM TV network, Kim Calhoun. Kim, welcome to the show. Welcome back. I know you haven't been on for a while, but we're talking about something that may be near and dear to your heart now, healthcare costs.
I don't think she wants to talk about it at all. Health insurance.
I don't want to talk about it at all. You know, you're probably living that issue. But healthcare costs in the United States continues to soar. We're looking at a David Walker says 42 trillion, but Blake and Peter are saying 200 trillion.
Give or take 50 trillion.
Give or take trillion deficit. What are your thoughts about healthcare costs in the United States, Ms. Calhoun?
I think that they're inflated because insurance doesn't pay the doctors and they have to recoup their expenses somehow. So they keep increasing the rates of our bills and what we owe. Right now, I'm currently going through a situation where they're not paying for my husband's medical bills at all. We paid the premiums on time, and by golly, if we hadn't, we wouldn't have insurance, but they have denied for every reason. I have had to file 5 appeals since his death on March 18th. I've physically called them that day to make sure everything was going to be covered and paid. And it has just been one excuse after another. And to this date, the bills haven't been paid. So and it's over $300,000.
Wow.
So the problem isn't health care. We've got great health care. The problem is because the insurance companies are not paying the doctors, period. And they're finding more and more excuses not to. They get all the money, they keep it, but they're not paying our bills as fast as we paid ours. And if I were a doctor, I'd be a little bit upset too. I mean, here I try to save a man's life. Worked very hard, put all the best equipment, all my best staff on it. I filed the paperwork, nothing.
Kim, I have a question. This is, I've worked in health insurance now for about 19 years. I was doing full-time, now I do part-time. I've had thousands of clients. I've dealt with a lot of people's claims. I've only worked with not every company, because there were some companies I just didn't feel were reputable, but with the ones I work with, I always tell clients this, I've never had a single claim where I felt the insurance company stole $1. Now you're telling me a totally different story, and I'm not saying it's false, but what reason are they saying they're not paying? Because out of all those thousands of clients, I never had anybody not pay.
The first time the denial existed was because they claimed that we were out of network, which by law, in an emergency situation, they cannot claim anything out of network because it was an emergency situation. Then they claimed because he moved him to a room. And there was just stupid things like that. He never gained consciousness. So it's been this extreme fight. From day one, the insurance companies talked to me. I provided them death certificates and everything. So recently, this has been since March 18th. Recently, I picked up the phone to call them to find out why they haven't paid the bill yet. And of course, they came up with another excuse. They said that, and I've already made sure that all the records were sent to them, all the bills, but they said that they still haven't received all of the records or bills. And I go, well, I know that's not true because we have receipt certificates that you've received them. But they go, well, we can't talk to you now until your husband signs the HIPAA form. Now, I have this on recording. And I go, HIPAA release form. Now, wait a minute. It's the same people, right? And I go, but you've been talking to me since March 18th. Does this mean you've been violating HIPAA since then? Or do you have a seance that you have our clients like me go to get him to sign the forms? What game are we playing here now?
Yeah,
so
it
has been an uphill battle. I find out from friends and family, oh, this is typical. This happens all the time.
Yeah.
But as well as I do, if you've been in the insurance industry, if you fail to get it covered and paid and reported within a certain amount of time, then they don't have to pay it. So I'm appealing every week. I'm going through a list of all of these bills, appeal, appeal, appeal. Now, the other problem I have is we have a secondary insurance. And we can't even file that until this one's paid. So I don't know if that's going to say, well, we're not paying it because you filed after 120 days. So, but again, I pay my premiums on time. His premiums were grossly inflated, if you ask me. Didn't generally cover a lot until you met a deductible, which we have. But it's outrageous to me that this happens all the time. This happens all the time. And
yeah, it's such a different story. I just throw this in for your benefit. One, in terms of, I have occasionally seen situations where it wasn't paid, but the provider never sent the bill. So you just tell the provider, resend it in, and it gets paid. The only other thing I'd point out is in an emergency situation, I've had some, but they pretty lenient about it unless there was time to go, if there's no time to go to the emergency facility. But if you book it ahead by a week or something, that's not an emergency. So I don't know if that was part of the,
No, he suffered a massive heart attack. It was right there in front of me. I tried to save him. We waited for EMTs came, took him to the first hospital.
That's an emergency.
Right. Took him to the first hospital that was available. We didn't have a choice. And, it's just been an uphill battle ever since. And I made sure I gave the card. I made sure I called them consistently. I made sure that they were getting the bills. They would tell me, oh, it's being processed. It's being processed. I would get the hospital and them on the calls.
Wow.
And every week it's a different excuse.
But I wonder, Peter, if it has to do with the size of the claim, because the claim in her case is about $300,000. Have you had any claims in the?
I've had clients who've spent $1 million in a year. Welcome to the healthcare system. Yeah. By the way, we had one client spend $4 million in a year. But no, I've had clients who had, again, it could be the company, it could be their operations. I don't know. Again, I wouldn't work with every company that was ever in Connecticut. But the ones I work with, I'm proud to say I had no problems. And I had clients say, oh my gosh, we spent $1 million. Thank you. We didn't spend $1 over. There is some paperwork. I went through it myself when I had one situation. And I had to make sure all the doctors sent in the bills because I got a bill or two. I said, you never sent it in. So they resent it in. It wasn't a big deal. I found clients who we had to do the appeals process, but it always worked out every time. So just stay with it, Kim, unless, again, I don't know the company. So if they're a legitimate carrier.
It's Aetna through IBM, their
really
future healthcare plan for retired employees.
They've got a very good name.
Yeah. Well, they lost a very good name with me after my last conversation with them.
Well, keep hammering on them because there must be solutions. Sasha, you have an idea?
Yes, Sasha.
Well, it's just getting upsetting, and it sounds to me just ridiculous that the richest country in the world, the United States, and citizens have to go through such a pain in such a critical situation. I just want to mention that in Canada, at least here in Ontario where I live, there is no such thing as medical bill. I never seen in my life a medical bill and how it looks like. I have no idea. When we're going to, whether it's a complicated operation or it's just a regular checkup visit to a doctor, you just don't care about the payments. Do you pay it up front or after the visit, or whether you just don't pay anything? You don't even think about it. All you have to show your OHIP card. It's Ontario Health Insurance Plan. It's a little green card. You show it, and that's done. That's all what you have to do.
Wait, Sasha, I have to say this now. I've had maybe 16 clients from Canada. You may not have to show cards, but I really question the quality of care in Canada. Almost all those clients told me horror stories. I mean, the first one was a woman hairdresser. This was like 18 years ago. She told me, my my mother, was in absolute pain for 6 months before she could see a specialist once. Then I heard the story. My friend was diagnosed with cancer, and they scheduled him for 6 months for chemotherapy, and he died while he was waiting. I heard so many stories like that. I had 1 or 2 clients from Canada tell me, oh, everything was great. But the majority of the stories were horror stories. I hear stories from England that are bad. I hear stories from certain countries that have public systems that are much better, like India. I heard from clients, because I have rural clients, but Canada is the one thing that stood out, because I get a lot of Canadian clients, because a lot of Canadians come here. I could not believe the stories.
Peter,
Sorry.
I think that what you're describing probably was true 18 years ago. I think so. I think that health treatments in Canada and all system improved in the last probably 5, maybe 10 years. Again, I'm not trying to prove that the Canadian system is the best in the world. Probably it's not so. But what I'm saying is that people don't have to worry about payment up front, or paying medical bills like in Kim's case, and then submitting the bills and waiting for payment of these bills or reimbursement of these bills. It's just ridiculous. I just don't understand why they have to pay upfront. You know what? I'll tell you one thing. In 2014, we were, with my wife, we traveled in Norway on the chess Olympiad. And unfortunately, my wife broke her hand. And we went to a local hospital. We had insurance with one of the Canadian banks. She was treated perfectly. They made a copy of our insurance, never charged up front anything, and then insurance covered that bill in full. But it wasn't a great bill, of course, because she had a minor thing. But still, this is how you operate. Why you have people in troubles with the health problems, either their own or their relatives, submit to the procedures of payment of sometimes, like in Kim's case, hundreds of thousands of dollars, and then worry about collecting this money back. It's just ridiculous.
Yes, Shaquille.
Can I just say, Peter, you may not know this. I had a well, I won't name the relative, but it was a relative very close to me who had an accident in Canada, and both the partners of that relationship were severely injured. One died in the accident, one stayed alive, and the one that stayed alive needed some pretty substantial medical treatment, and I got that at Vancouver General Hospital in Vancouver. So I can certainly attest that I was very impressed with the medical system, the healthcare system in Canada. I thought it was well run. I had organised a whole heap of money to pay for things, and I showed up there and said to the hospital administrator, "Here's my credit card. I'll arrange more money." And they said, "You're in Canada. Don't worry about it." But I can also say that tongue in cheek. But the reality is, I think for most Americans, and from what I hear from most Americans, is that they don't feel that they've got the same sort of freedom with their healthcare as what we do in Australia, or is that what most people, I think, in Western countries have, which is that if you're sick, you go to a doctor. It doesn't have to be like in the UK, you generally have to see a doctor that's in your network, but you can go and see an out-of-network doctor, right? And that's run by the NHS. But for like most places like Australia, you can see any doctor you want. If you're sick and you need to go to the hospital, you just go to a hospital. You don't worry about any of that stuff. And I think it's not just the idea that you might not get your claim paid for later on and have debt collectors, afterwards. But I think a lot of people as well will find themselves trapped by an insurance company saying, well, because I've had this serious thing occur, I'm now not able to change policies, or I'm stuck with my employer. I can't move jobs because if I move jobs, my health insurance is going to go up. And I think that that's probably something that's beginning to have an unquantifiable negative effect on the economy, because it hurts a lot of middle-class people. It's not just the poor, it's middle-class people. It's even people that are relatively well off. So I do think that the healthcare system in the United States needs to be improved. To your point, Peter, you're right in what you say. When you've got universal healthcare, you will find that people will end up waiting in a queue. And this is a debate that sort of goes on in Australia, because Australia has that mixed system. We've got Medicare, which covers everybody, every Australian citizen and most residents get Medicare. but you also have private health insurance. So if I needed something done that was not a medical necessity, but it was something that I wanted, because I've got top level private health insurance in this country, I can jump to the front of the queue and I can go and get that care straight away. Now, I happen to like that system because I think it enables people who are more able to pay for things, more able to afford things, to be able to go and see various specialists of their choice. They've got the freedom to go into private hospitals, and generally the waiting lists are going to be shorter. But it's just not true that more money creates more doctors. You don't have more doctors as a result. So if everybody has the same access to healthcare, of course queues are going to be longer, and you end up with the problem that Sweden had, which is why they stopped people. A lot of countries in Europe stopped people from being able to even pay for services themselves, because the problem was that if you're not happy with the queue, you can pay a bit extra and jump it. If you're not happy with the treatment and the other treatment you want is more expensive, you can just pay more and then jump the queue. And so those people at the bottom are missing out. So I think that's, trying to get that balance right is a difficult one. And I think that, again, when politics gets involved in this, it ends up being about what works best on party lines, who's getting, lobbied the most, that sort of stuff, instead of being about actually how do we create the healthcare system that's going to help the most amount of people. I'm not saying that the American system should be universal healthcare, but I think it should be improved away from what it is. And to Sasha's point, who's unfortunately not here, for his great comments about the Canadian healthcare system, perhaps in British Columbia they'd disagree, given that they're the only place that actually has to pay. They've got a special tax, which is only on the residents of BC for their healthcare.
I'm surprised to hear that, because in Ontario there is no such thing.
It's a tax. It's not a co-payment, but it's a tax that they pay in BC.
They're very, very enterprising people.
It is very enterprising, but you eliminate the queues when you increase your doctors and medical staff and people. And the only way to do that is to increase their ability to know that they're going to get paid, because people don't want to enter into a field if they know that they're not going to get paid, or it's a struggle, that it's going to cost them more money than it's worth, because it takes a lot of years to become a doctor, right? You invest a lot of money and time. So I think that you're going to eliminate those queues if you make it easier for doctors to become doctors and medical staff to become medical staff. And another problem that we're having in this country isn't just the fact that they're not paying bills, but they're dictating what kind of care I can get. The insurance company will come back and tell the doctor, well, we're not going to pay for that procedure. We're not going to pay for that test. And then I have to get on the phone with them and say, why are you not paying for that test? Or another thing that Shaq brought up was you don't want to change your employer. But it's not because insurance is going to cost you more. It's because you're going to lose the deductible that you had with the insurance that you had. And if you maintain the insurance and pay for COBRA, then yes, the insurance is going to cost you more, because you're going to be paying $1,500 a month to keep that insurance, where previously you were only paying $200 a month for it. So yes, Shaq, you're absolutely right when you say that you can't even change your job nowadays for fear of what's going to happen with the insurance company. But I get more furious over them telling me I can't have a certain procedure because they find it not applicable, or I have to jump through hoops to get a certain test done because they don't want to pay for it. So I think I'm more appalled at that now too. So I think our problem with our system is our insurance is unhealthy. I think we need to bypass the insurance, go to a blockchain system where people pay in like a tax or something, but pay in monthly, and the doctors are automatically paid. They won't need to be paid as much because they won't need the admin staff to file all the insurance claims and the appeals and the appeals and the appeals and the bills. So they will just need more real doctors, which then you don't have a queue. So that's my solution.
There's something very interesting about the health insurance industry there. And look, it's one of the rare times, I do say it occasionally, but it's one of the rare times that I'll say I think it needs more government oversight. I think it needs more regulation. In Australia, a health insurance company cannot say, well, you're at risk of a heart attack, so therefore, we're not going to insure you, or we're going to give you this huge deductible, or that sort of stuff. That's just not how it works here. It was very interesting. I was looking a few years ago when I thought I'd be spending a lot more time in the United States. I wanted to find out about expat health insurance, and I went through the insurer that I normally use in Europe and Australia, which is Bupa, and the Bupa IHI actually had a policy. It was the sort of ultimate global superior policy. It's their top policy for the world, and it was $50,000 a year. And I thought, wow, that's quite something, actually. And there was a few other companies, Cigna and a few others, Aetna, the one that you mentioned before, they came in at around sort of 10, 12,000, but it didn't quite cover as much as Bupa. So I got talking to them, and I just said, like, 50,000 seems really high, what's this for? And they said, well, you put on your form that you're going to be a resident of the United States, or that you are a resident of the United States. I said, oh, no, I'm not a resident of the United States, but I think I'm going to be spending some time there. And they said, so are you British or are you Australian? I said, well, I've got both passports. They said, oh, well, we'll give you a phone number, ring back the Australian office. And all of a sudden, the same cover cost $15,000. So that really showed me something, that obviously there's a difference between how they will treat people in the United States versus how they'll treat people from elsewhere, because Australian regulations wouldn't let them do that to an Australian expat. Neither would British. The British one was a little more expensive, but neither would British. But it came in at 50,000 as soon as they thought I was American.
Well,
So
that's because we're the best healthcare system in the world, and so you have to pay.
Yeah, that's what I was going to say. And you know what? I have data. I just pulled up a few articles. First of all, about Canada. This is what I was saying. It may have improved somewhat, Sasha, but the two articles I could find, I'm sure I could find more. One was 2015, so it was a little outdated, but it said in 2015, 52,000 Canadians crossed the border into the United States for healthcare, and that was a 25% increase. But also I have a 2018 article from Forbes that says 1 million Canadians were waiting for necessary healthcare. They're in the queue. Now, what I've heard is they go to the black market. There's a big black market in Canada, so they go private, or they come to the United States. And the United States is a great healthcare system. And you know what? They knock the United States a lot for, oh, look at our healthcare outcomes. Well, guess what? The U.S. has about 1/3 of people, maybe more, obese. So we have really, our diets are terrible on average in the United States. No, well, my point, Shaquille, is that the argument against it is they say, oh, look, in this country, our costs are lower. But when you take people who are more prone towards diabetes, towards heart attacks, towards everything, it costs more to treat those people. And the final point, you don't think it costs more, Shaquille?
No, then what? Canada? I mean, Canada has similar rates of obesity.
No. I was making two separate points. On Canada, I'm making the point that there is a queue, and it's huge, as of 2019 article in Forbes.
What's the queue in America of people, or how many people in America aren't even on a queue because they don't have?
You can't in the U.S. You can't, and despite Kim's experience, which is again unique to my experience, and I've dealt with thousands of clients over the years. Kim, it's a terrible situation. I'm not knocking it. I keep digging to get to the bottom of it, and Shaquille, I'm talking to Kim. 1 second. So I'm saying, Kim, I keep digging because there's got to be things holding up, and maybe they're resisting, but it's very unusual. But in the end, they have to cave. Because here's the thing, Shaquille. In the United States, if you deny health care, you're going to have a lawyer in a second. First of all, the insurance companies have appeals. Second of all, you go to the insurance department in your state. What are you in North Carolina? And you know what? The insurance department is going to say to the insurance company, what are you doing to this person? So you should maybe go to them too. But also the third level of Shaquille, the third level of appeal is lawyers. So if you deny coverage to somebody, in the end, after going through the insurance department appeals, the insurance company appeals, a lawyer is going to sue somebody if they don't provide care and somebody dies for $10 million. Because we have very unlimited malpractice laws, which I think are almost too extreme because of economic damages, everything which drives our healthcare costs up. So
you sidestepped my question altogether.
What's your question?
You made the comment that there was a million people on a waiting list for necessary care in Canada. And that's not emergency care, it's necessary care. And I said to you, how many people in America are on a queue? Or how many people can't get on the queue because they don't have coverage for that? They don't have insurance coverage at all.
I'll answer.
There's not standard procedures that people can't have. And I would struggle to believe that those people that are homeless living on the sides of the streets of Skid Row are going to be, able to get easily the healthcare that they need.
I'll answer that. And by the way, the U.S. system has a lot of things that should be improved, without a doubt. I mean, and they've thrown a wrench into the system with Obamacare, which reworked everything. It had some advantages, but I'll answer your question. So first of all, in the U.S., very few people are waiting for necessary care because, first of all, if you show up at a hospital emergency room, they have to treat you. Even if you're a non-resident alien, you could be from another country. You could have gotten into the country yesterday. You could have no insurance card. You could have no cash. They are required to treat you. Absolutely. And so anybody who needs emergency care gets emergency care. And if you need a doctor's appointment, if you have a decent insurance company, you just make the appointment and the doctor takes you and that's it. You don't wait 6 months for chemotherapy.
Now, hang on. Sorry, Peter, again. The comparison that you gave, you used Canada and you said for necessary procedures. A colonoscopy might be a necessary procedure, but that's not going to be an emergency procedure. So if people are waiting for 6 months to get that, that's not an emergency. It's just a necessary procedure. How many people in America are waiting? If you're going to compare apples to apples instead of apples to oranges, I agree with you, though, that when you have universal health care, what happens is that queues get longer. The question is about, on the ethics side of things, who is able to jump that queue? On what basis should they be allowed to jump that queue? I mean, I like the Australian system, but then again, I can afford it. I was undergoing, and I'll continue to get the dental treatment that I wanted in the United States. Now, that's going to cost in Australian dollar terms about 150 grand. But I can't get the treatment here in Australia. But I can afford it. The everyday person can't. And that's I think, where the concern is.
In the United States, if you have insurance, which most people do, and by the way, now under Obamacare, there's very inexpensive insurance. You could not believe it, which is going to drive the deficits up unbelievably. Nobody's even talking about that. But I mean, I sign up clients with families where they're paying $10 a month, maybe $50 a month, $100 a month for insurance, where the government's tipping in $2,000 a month. It's so subsidized. It's basically public in a lot of ways. So let's say you have an insurance you have some insurance in America. Let's say you need what you consider necessary. You call a doctor's office. They say, we'll see you in 2 weeks or 3 weeks. If they say we're too busy, we'll see you in 4 weeks, you could say, okay, I'm calling another doctor. There's not now there are some shortages in rural areas, thanks to the AMA. Most possibly they have something to do with that, but then you might have to travel a bit to get to a doctor. But there's doctors all over the United States who are taking new clients. 95% of people take insurance, by the way. I could tell you that too in the United States. 94% take Medicare, 95% take insurance. So you call a doctor, you go see them. If you need care, you get care.
Well, and you have to be careful with insurance because a lot of them will have in-network, out-of-network, yes. And you have to be careful about the facility you go to because your facility might be in-network, but the doctor is out-of-network. So before you even go see a doctor in the United States, you need to pick up the phone. You need to make 25 phone calls to go, is this doctor and is this procedure going to be considered in network or out of network? And is this blood work going to be in network? So our system is sick. In the last 10 years, we have become this dysfunctional healthcare society. We have great doctors, the best in the world. We have plenty right now, but in 10 years we're not because people don't want to become doctors anymore in the United States. It's too complicated. So we're going to have to narrow this down a little bit and make it easier for people to become doctors. I think if we got rid of the insurance companies And those people can start turning into medical professionals. We won't have a huge queue. We'll have a huge system for people to go to for health. They won't have to travel far. We don't have a system that denies anyone because of race, color, or finances. We have a system that just treats people and medically takes care of them. And to address the situation where some people are paying $10 and some people, unfortunately, are paying $2,000 for just premiums that don't cover jack crap. I think that, excuse me, Nick, I think that we can kind of blend it so that the weight's not carried by the middle class and make it even across the board. And then the heavy weight isn't coming out of the taxpayers.
Well, that's income-based, Kim, just so you know. It
Yeah,
all depends on your income
It's
now.
not, you might be reading a different book than I am here in North Carolina. And to also address something else, the insurance commissioner will not get involved if your insurance is via third party through an employer or your retirement. So the insurance commissioner does not get involved in North Carolina. Only unless you have your own personal insurance. So if you went through the healthcare system through Obama's healthcare, then that's considered third party. So the insurance commissioner kind of puts his hands up and says, I'll write a letter, but there's nothing I can do. So I've already...
Wait. Group insurance is third. I'm not going to get into the details, but look, I do individual companies through the Access Health in Connecticut. Companies like Blue Cross and Connecticut. Those, we get subsidies for the clients, very huge subsidies for many clients. And those are individual companies, and the insurance companies are regulated by the insurance department. I know you've had a bad experience, Kim, and I don't know I don't know why, but you need to dig deeper because I'll bet it could be straightened out within a week or two if you talk to the right people and just keep pushing.
Tim can talk to you off air and you can give us some pointers, Peter.
You need a good agent.
Yeah, maybe I'll talk to you after this. But I will say this: everyone I talk to said this is common now. Everyone I speak with says this is so common. You're probably going to go through 6 appeals before they pay anything, and it shouldn't be. The doctors should be paid just as fast as I paid the premium. If I paid that premium on time, then they should be paying my doctor bills on time. But
I guess North Carolina has an issue. I know.
The credit protection agencies or whatever will always tell you, pay the amount of your phone bill that you agree with and just don't pay the amount you disagree with, and we'll lodge a complaint about that. Right? If you've got a $200 bill and you agree with 150 off it, pay the 150. We'll dispute the other 50. So the health insurance company should be doing the same thing at a minimum, right? It's paying the bit that they agree with, and then they can tell you which bits they don't.
Well, it's interesting you discuss all this because years ago when I was practicing law, there was a attorney I ran into, Dennis, so I won't name his last name. And I said, Dennis, what do you do? He goes, well, I represent insurance companies. And I said, well, how do you do that? I follow the rules of 3Ds. I said, what's the 3D rule? He says, well, everybody knows the 3D rule, right? I said, I don't know what it is. He said, it's real simple. Deny, delay, don't pay. And that's how you represent insurance companies. So I was going, okay.
Yeah, that's right.
Deny,
I would like to mention something. Maybe, I think you hit it right. It's exactly a situation where the old book published many, many years ago by one of the university press, the name of the book struck me, and I read it subsequently. The name is Why Son of a Bitch Succeed and Nice Guys Fall in Small Business. This is exactly what they show, that the nice guys, they're paying their bills on time, they're trying to be nice to everybody or so on, and son of a bitches, they don't pay on time, they will go and argue for every penny or so on. And that's exactly how, listen, this is all about how the business works. So I'm sorry for you, Tim, that you got involved in such a situation as we are discussing now, because the simple reason for them is exactly what Nick just said a minute ago.
Okay.
Let me,
Sasha.
You know what? Let me bring a bigger point, which is, back to the main topic. The world is, the governments have taken over a lot of healthcare. in the United States, it's over 65. I just went on Medicare this month. I had some treatment, free, boom, nice, simple. But the world is governments are handling healthcare. But my point is, the world governments are not telling people how much they owe on this healthcare, and their social security systems and their long-term care, and it's monumental. And it's really a sham and a fraud. And in the end, it's not a question of whether the U.S. is going to be a superpower. It's how each country is going to adapt to these monumental, gigantic, unbelievable, unfunded liabilities when they start having to deal with it. And
it's a hidden tax.
My number one concept is that they're going to drive interest rates down to zero, among other things, and that's why you need to invest that way.
All countries will have to sell their liabilities to China, and that will be the end of story.
China's got a worse problem.
And with that,
China's
we're going
demographics
to
are terrible.
end the show. Well, thank everybody for showing up on Economics Monday. We'll see you all next week.